Welcome back. This is part 3 of my Mental Health Awareness Month Informed Consent series. Hi, I'm Dr. Iman Hippolyte, a double board certified psychiatrist with over 20 years of clinical experience, and I not only help high-achieving women overcome high-functioning depression, anxiety, and burnout, I also help high-achieving women shift from grinding to thriving. As a reminder, what I'm sharing in this series are generalizations. There will be exceptions to what I'm sharing, and this is not about assigning value to one person or specialty over another. It is about giving you the information you need to make informed decisions about your care. Now, if you're receiving care from a clinician who goes by doctor, it is important to ask or search for what their doctorate is in. Know that if they do not have an MD or DO behind their name and did not complete a residency in psychiatry, they are not a psychiatrist. Similarly, if they do not have a PsyD or a PhD in psychology, then they are not a psychologist. Psychiatrists and psychologists are generally the two categories of clinicians that carry the most expertise, education, and training in mental health. Now, psychiatrists, like myself, are medical doctors who are trained to diagnose and treat the full array of mental health conditions and to distinguish whether symptoms or concerns are mental health, physical health, and or behavioral health in nature. We can prescribe medications and do therapy, although because of the nature of insurance companies' control over our health system, they prefer to reimburse other clinicians to do therapy instead of psychiatrists in order to cut costs. But don't get me started on that. Now, psychologists do not go to medical school, but they go to graduate school to obtain their doctorate. Clinical psychologists specialize and have expertise in psychotherapy, and many also specialize in psychological testing and diagnosing of mental health conditions. With the exception of a handful of states, psychologists are not trained to and do not prescribe medications. In the next part, I will walk you through the remaining clinicians you're likely to encounter in the mental health space. Knowing who is providing your care and where their expertise lies is a foundational step to making informed decisions about your care. Like, follow, and stay tuned for more. Bye for now.